Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Carlos Zamora, Professor of Radiology at University of North Carolina, Chapel Hill, who is editor of our Neuroradiology section. In this video, he'll be sharing with us his insights about the area. Carlos, thanks for joining us.
Andy, thank you for having me. It is a pleasure to be here.
Can you tell us about your background in neuroradiology?
Before residency, I actually was more interested in interventional neuroradiology. And I went to Japan, did my PhD at the University of Kobe, where, my purpose was to become an interventional neuroradiologist. But along the years, I became more interested in the diagnostic process of neuroradiology. I met some great and inspiring people. And so I moved to the States. I started my a combined residency fellowship at Johns Hopkins Hospital. I was there for 6 years, after which I took my first job at the University of North Carolina at Chapel Hill, where I have been for 9.5 years. And I do 100% neuroradiology, mostly adults. I do 15 to 20% pediatric neuroradiology. And we have a large volume practice with high complexity cases. We see essentially everything across the board. But my main areas of interest are neuro-oncology, adult and pediatric neuro-oncology, as well as the skull base and the temporal bone.
Thank you for that background. Let's move on now to the journal section. What trends have you observed for recent AJR submissions in this space?
Yeah, I have noticed two main trends. One of them, I think the bigger one, is artificial intelligence. Not surprisingly, I think there's been a lot of submissions on artificial intelligence, different ways of applying AI to neuroimaging, whether it be by improving the image quality, super resolution or denoising or artifact reduction, or by, creation of models to predict clinical outcomes, like delayed cerebral ischemia or expansion of hematomas and so on, or, to improve the classification of disease in some form. Or also what we have seen is submissions on artificial intelligence to look at lesion detection and compare it with human readers, or how it may be able to improve workflows or turnaround times and so on. The other larger trend that I have seen is with photon counting detector CT. It's a relatively new technology, and we've seen a few submissions on CTA, on improving parameters for imaging with photon counting detector CT, different applications for neuroradiology, for head and neck, spine myelography. We've had submissions on detection of spinal CSF venous fistulas, for which we had a recent publication on that. So those are, I think, the two main trends that I have noticed.
Yeah, we definitely have had some exciting submissions on photon counting detector CT for a range of neuro applications. So what do you see as areas of priority for publishing in neuroradiology over the coming year?
I think there's several potential areas of priority. One of them is, application of any new technology to answer a clinical question. We just talked about photon counting CT. I think there's still room for research. How can we use ultra high resolution? Can we take advantage of that for different neuroradiology applications? Any innovative ideas for using this technology? The capability for material decomposition, for instance, finding applications for that to solve a clinical question. I think that's important. I think there is a lot of room for research in neuro-oncology. I think we need better predictive models for evaluation of fractional tumor burden in neuro-oncology, to try to determine what the proportion of what is the proportion of treatment effects versus progression. There's some work being done of that. That still needs to be refined using advanced MRI, molecular imaging, maybe multimodality. And I think that's especially important now that more places are using more and more immune therapies. We have CAR T therapy, and there's a couple of issues with that. One of them is that many of these patients get these very large responses with new enhancement, right? And we don't know what is progression or what is primarily treatment response. So tying back to, better tools to try to distinguish one from the other. And also with CAR T, for example, some patients get such a profound inflammatory response that they might not be the best candidates for the therapy, right? They may not be eligible, right? Because they might have this complication. So better imaging predictors of treatment response, of eligibility. And in addition to that, I think in the same realm of neuro-oncology, we had this recent WHO classification of tumors of the central nervous system that now relies much more heavily on molecular characterization of tumors, right? And that's really changing how we interpret, how we look at this the scans of different tumors, right? We need to rely more on molecular imaging. And so I think predictors of molecular statuses or of disease, we have had some success with that in the past. Now we have the relatively well-established, T2-FLAIR mismatch sign for IDH mutation status, for example. There has been some work done with spectroscopy, like 2HG status determination. But there's many other molecular markers that are, being done on a routine basis for these tumors on the pathology side of things, molecular side of things, that I think we need to catch up with the imaging to try, to improve the way that we interpret these scans. And similarly, in the head and neck as well, determination of HPV status, for example, for head and neck cancers. So I think neurology is one important area there. Dementias, Alzheimer's disease now with the new therapies. There's some work that is being done on imaging prediction of biomarker status. And I think we need to know a little bit more about which patients are going to be benefiting more from these therapies, right? So eligibility, refining eligibility criteria, that's one important thing. So, where does imaging fit with that? And also which patients are more likely to develop the complications like ARIA-E and ARIA-H. I think that's another important area. And if I may add just one final thing, I think with image overutilization, I think especially in the ER setting where neuroradiology takes a big burden of this, because we know a large proportion of what is seen in the emergency setting is neuroradiology. So I think research that aims at finding new strategies, ways to improve workflows, whether it be by optimizing protocols or using, AI tools to try to improve this. I think those will be areas of high impact potentially.
Yeah, certainly tumor response assessment and molecular classification are ripe areas for research using new imaging methods. So what tips do you have for authors looking to publish in the area?
So I would say that those submissions that are usually well received are those that address a clear clinical problem, that there is an unmet need. In general, I would advise that, authors avoid being overly technical in their manuscript or sending manuscript that lack a clear practical applicability. I think a good advice would be to try to demonstrate how the findings of your study will potentially be able to improve diagnosis, patient outcomes, how are they going to improve clinical workflows and that sort of thing, depending on your study. And that applies for AI as well, right? I think studies that are done with artificial intelligence, we're looking for studies that have a clear clinical application, right? That there's some clinical relevance to it, rather than you simply have a study or we're simply having a technique that is looking for an application. And I would also say that it's important to stay informed about the latest trends in the area and the hot topics in the field. And I think one way to do this is by engaging in what is being discussed at the scientific meetings that can provide you with some insight at what the areas of interest are, what are the emerging challenges that might be ripe for research. And finally, I would say, and I find this very helpful, is talking to clinicians, right? Attending multidisciplinary conferences. They provide a different clinical perspective, right? It's really helpful for us to try to understand what clinical needs are. And that, I think, will eventually lead to collaborations and more impactful research.
Yeah, that's good advice about relying on one's referring group as well as presentations at society meetings to really get a sense of what's on the cutting edge in one space. So are there any particular common pitfalls that you're seeing in submissions?
One recurring thing that I have noticed is, lack of clarity in the study design. Sometimes it is not very clear, what the clinical setting is, or the patient selection process is not very, very clear. We don't know what the database search parameters were, what selection criteria were used. And this is important to try to understand what sort of biases there might be in the study, and it also affects generalizability and reproducibility of the study. I think that it's important to have clear methods, well organized results, and a discussion that will tie the findings back to the research question. So I think that ensuring that the methods are thorough, that the results are presented in an organized fashion, in a logical fashion, I think will do a lot to improve your study. Another thing is that some studies, I would say they lack some consideration of what the clinical relevance of the study might be. We have studies that might be just overly technical, and it's not very clear what the clinical relevance is, right? And some of these studies, are very clinically relevant, but it just hasn't been articulated in a way that is easy to understand. It just hasn't been framed in such a way.
Anything else that you'd like for our listeners to know?
So one thing that I would like to highlight is the importance of collaborations, whether it be multi-institutional studies with different academic institutions, or collaborations with other specialties like neuro-oncology or neurology or neurosurgery. I think that those studies tend to lead to stronger research that is more impactful, that is more clinically relevant. I would also like to encourage authors, especially those who are early in their careers, not to be discouraged by, rejections or extensive revisions. It's just part of the process. Revisions, each iteration we just make your study stronger, so I would advise, authors to engage with the feedback from reviewers and just see it as an opportunity to refine your research, try to clarify your findings. And as for rejections, just I would like authors to understand that, you might have a great paper, right? But it may not just be the best suited paper for our journal, right? It might be a more specialty type of paper that is more suited for other journals, or it may be a little bit overly technical, that it may be better suited for a different journal. One thing I would just like to encourage authors to try to keep an eye on how the field is evolving. I think that is critical. I think paying attention to what are new technologies or updated classification systems that might be coming up, emerging therapies, or any changes in clinical practice. I think those are all areas that could potentially lead to impactful research.
Yeah, I appreciate you raising all of those points. Carlos, thanks so much for joining us.
Andy, thank you. It's been my pleasure to be here.